Happy holidays, Merry Christmas, happy hormones. When was the last time a television host asked you that, huh? Well, when was the last time you talked to Angela DeRosa? Dr. Angela DeRosa, you're always here talking about hormones, the lack of them, the abundance of them. Some women just don't like this time of year, though. Mm-hmm. And sometimes, I'm not picking on women, but it just seems as if they are affected depressively by this season more than men, and I'm not quite sure
why.
Well,
I think men tend to be oblivious to things around them in general.
Just a second. Angela takes shots at testosterone.
No.
All right, so what's going on? There are a lot of women out there right now saying, why am I not really happy when everybody tells me I'm supposed to be?
Well, this is a crazy time of year. I mean, women tend to be the stress holders of the household to begin with, and we have just now amped this to 11. So we got all the holiday shopping. We're supposed to be cheerful. We're trying to deal with the family dynamics of making sure Auntie Sue gets along with Auntie Carol and all these different dynamics that can go on.
And that does kind of fall on
the wife,
but does it also happen to women of I'm not going to say an advanced age,
middle
but as opposed to the 25-year-old, does it happen more often to the 50-year-old?
Yes. Well, at that time, it's kind of a perfect storm of things. So we're also the sandwich generation where you're caring for your elderly parents who may be declining and you worry about them. Are they going to make it through the holiday season? It's also a time where a lot of deaths occur, or it may appear that there's a predominance of death, and it's because it touches people more distinctly at that time. Thanksgiving, Christmas time, if someone dies around that time, you don't forget those kind of hallmark moments. Also, we have kids that are growing up and maybe starting their own traditions and families, and they're pulling away from that family unit. So you kind of have that empty nest of the holiday season occurring. And then you throw in all the Christmas shopping, and then if you have hormonal decline, which makes you not cope as well with that, it's just a recipe for disaster.
Is it a hormone deficiency?
Yes. Typically, we can see an estrogen deficiency, which may make us more weepy, or a testosterone deficiency in women that makes us actually not cope as well. We become more irritable, anxious, depressed. So you throw that fuel on that fire of the stress of the holiday alone, it can really be troublesome for
Excuse me, what? What, we're getting calls, and they're saying what? A lot of folks are saying, I recognize the problem. What am I going to do about it?
Well, first and foremost, try to give yourself a little extra TLC during this time. Recognize that this is a stressful time. If you've got a great support network, I mean, unfortunately, families are disjointed nowadays, spread across the country, so that makes it harder. But find those support things with your friends, family. But if it's truly a hormone imbalance contributing to that and making it harder to cope, that's where I can help. So come talk to my folks at my office or myself, and we can help you deal with the hormonal side. But recognize that this is a hard time. Don't be so hard on yourself, and get the support you need, either through medical care, and if it gets really bad, we can treat with medications too, where there's a chemical imbalance. But that should be the very last area that we go to. We should look at all the other causes first.
Okay, so there are a number of problems, but there are also a number of solutions.
Absolutely.
And an emotional solution?
So if it's truly emotional, there could be counseling, so getting to talk to somebody professionally. Worst case scenario, we might consider medications. If we balance the hormones, deal with some of the stress, get you that outlet that you need. But don't suffer in silence. Unfortunately, this is also a high time for suicide. So we really want to make sure that you're not isolating yourself. Reach out and touch someone.
Boy, and we keep getting that message. The songs. Everybody on television and radio, every magazine you pick up, no matter where you are, the message is clear. Be happy. What's wrong with you?
There's nothing more annoying than being told to be happy when you're not feeling that way, honestly. There's so much stress to be happy, to have that family joy. And we also set ourselves up for that perfection of the holiday and that day. And I don't know about you, I've never been to a family event that was perfection. I start drinking the morning of just to get through.
So there is then that medical choice.
Yes, exactly. The Xanax or the alcohol, take your choice.
Yeah, but make sure that you don't do that too much,
No, I'm kidding. Absolutely kidding. But certainly don't expect so much. I think we put so much pressure on that day to make us happy and joyful, and it most often doesn't always happen.
You know, here's one I could only ask you. Right? all of a sudden the tension shows. What is he going to say? I'm going to say that a lot of male doctors look at a lot of female patients and say, get over it. It's all in your head. Answer them.
Well, first off, that's the most patronistic, annoying thing I've ever heard a physician ever say to patients, and believe it or not, it happens all the time. Women, it's not all in your head. Certainly if you have the hormonal declines, that could be a chemical imbalance that's in your head, but it's not just something that you're overreacting to. Certainly you may have, obviously, the stress, you may have cortisol levels that are spiking through, that are creating a lot of anxiety and stress for you, but it could be just sheer chemical imbalances. Men deal with things differently than women, oh shocker. They tend to take the more stoic approach, where they either bury their head in their sand and they don't want to deal with it, where women are more willing to take it head on and at least discuss it and talk about it. But when doctors say that, it's because they have something that they're uncomfortable with, not the patient. So
okay, so if you take anything away from this conversation with Dr. DeRosa, is that if a doctor says to you, you women, get over it, it's all in your head, it's something you're imagining, here's the solution. Get another doctor. Huh?
That's perfect.
And it could be even Dr. Angela DeRosa in private practice in the Valley of the Sun. So are we. We're the staff of the Morning Scramble.